Welcome to Empowering Plans, a show dedicated to identifying waste and undue expense in the health benefits industry, discovering ways to maximize benefits while minimizing costs, and empowering employers, administrators, and consultants to emphasize, once again, the benefit in benefit plan. Today's episode is brought to you by the Phia Group, empowering plans since 1999. Now here are your hosts, the Phia Group's own CEO, Adam Russo, and Senior Vice President and General Counsel, Ron Peck.
And Brady. This is the Phia Group's Empowering Plans podcast, coming to you live from Braintree, Massachusetts. With you today is your host, Matthew Painten, Marketing and Accounts Manager. And next to me, we have Philip Qualo.
Hello.
Phia's Compliance and Regulatory Affairs Consultant. And we also have producer Pat Santos with us.
The man,
Pat Santos. All right. So, Philip, I think we're missing a few people here at this table.
Yeah, where's Ron?
And
where's Adam?
Brady, Ron, Adam, Brady. No one? No?
Anyone?
No.
Anywhere?
All right.
No?
So we are missing a few people here because they're all traveling. So Philip and I decided that we were going to kind of make our own podcast.
Yes. And I think we're going to do an employee takeover.
I think we are.
Yep.
And you know what? What are we going to talk about?
Well, the cat's away, the mice will play. I guess there's a variety of topics. But here's what I was thinking. I know a lot of the programming we have through our webinars and through our podcasts, which we're all big fans of, usually aims at educating our client base, which are the TPAs, the third-party administrators, the brokers, and it's usually on the plan sponsor end. But how often do we have a program that's from the member or the plan participant point of view?
Well, being the marketing and account manager here for the past 2 years, I can say a solid 0 times. Zero times. Yeah.
Okay.
Yeah.
So
on
I
the
think
Empowering Plans podcast, we've talked about it from the member's point of view or perspective about 0 times.
Okay.
So let's take this podcast over and let's tell it how it really is.
Let's do it. I second that. Let's take this over. Employee takeover. Woo! All
right. So let's start off by talking about what you love about our plan, or your perspective. What is your perspective about our plan? You have had more experience in the industry. You've worked for more companies than I have. I've worked for 2 other companies besides Phia. So I've had 2 other health plans, and I was too young to really know what I was paying for, and I didn't really use my health plan. I think maybe like one time I sprained an ankle or something, other than the standard physicals. So kind of tell me what your thoughts were when you first started.
Well, I can tell you, I absolutely love our health plan. And I'm not just saying that because Adam Russo might hear this.
He's definitely going to hear this.
Oh, okay. But still, even if he does hear it, I'm saying I love our health plan. And I'll tell you why. Before coming to the Phia Group, I had no idea what a self-funded health plan was. Most of my background has been in the fully insured realm, not only working for fully insured carriers, but actually being covered under a fully insured plan.
So working in healthcare, you didn't even know what a self-funded health plan was?
I had never even heard of a self-funded health plan.
That's interesting.
And what's interesting is, before I came to the Phia Group at my last job, when I explained to my boss that I was going to be moving along with my career at the Phia Group, and I explained that it's a self-funded health plan consulting group, complete backlash. Oh, that is crazy. That's ridiculous. Who would ever want to sponsor a self-funded plan? You're just going to bleed money. So, of course, that was in the back of my head. And, of course, I didn't know too much about self-funded health plans. And then I came to the Phia Group. And let me tell you, I don't know where he was coming from, because the plan I was under at my last job was a fully insured high-deductible plan. I am one of those type of ideal plan participants, I would like to say. I mean, I am in my 40s. However, I usually do not need medical care that often. I'm the type of person maybe checks in with the doctor once every few months. I have my annual physical and I'm all set.
So he's borderline perfect.
Oh well, yeah. I wish.
You don't look a day over 32.
Thank you, Matt. I'll take that. So as someone who wasn't a heavy claims user, here I was under a plan where I was paying almost 70% of the cost of my medications. I was paying most of the cost for my doctor visits. Regardless, in out of network, it was all the same. It was coming out of my pocket until I reached a certain deductible. However, the problem was I never hit the deductible. So I was paying for insurance, which was very expensive. I won't name the carrier, of course. I was paying for insurance that, and all I received in return was a discount.
I would like to say I have never, but when I worked for my two previous companies, I never hit my deductible.
Never?
Ever. Not once. Not once.
I know that's supposed to be a good thing, but it doesn't feel good when you're paying high cost premiums.
Yeah, I would pay my copays to go see my doctor and my prescriptions, and that was it. That's all. And I never once hit my deductible. And from what I hear, based off of what I've listened to on our previous podcasts and webinars, is that most people don't actually hit their deductibles, but they think that they have to pay so much money towards their deductibles in order to hit it. So then their healthcare will then become quote unquote free. Moving forward for the rest of the year until January 1 hits, and then your deductible just resets again.
So from what you're saying, they'll spend all that money. And then hopefully to get to that deductible by December 1st. And then by the time you get
exactly
some, covered healthcare, boom, the deductible's restarted. I know exactly what that felt like.
Yeah.
Because that has been my career, my life for the past 15 years.
Right.
So then I came to the Phia group and, in discussing, like I said before, I had no idea what self-funded health plans. I was hired for my legal background. So in dealing with our human resources recruiter, the selling point was the self-funded health plan. She was saying things to me that I did not even think existed. What do you mean no cost generic drugs or no cost sharing on my end? What do you mean a direct primary care where I don't have to even pay a copay? What do you mean $20? This was all strange to me.
And this was before we had direct primary care.
This was before. I didn't believe it. I didn't believe it.
So when I first got hired at the Phia group, this was 2 years ago, we had the $0 generic drugs, we had the $0 copay for urgent care, we had the diapers and wipes program. I mean, we still have all these programs that we'll go into detail a little bit later about, but we have all these incentives. And then come to find out, we're paying 1/3 of the national average of what people typically pay for their premiums.
Right.
We're paying I think when I first started, it was $127.58, which is, I think Adam's going to fact check that. But well, I mean, I'm sure it was pretty close, but a month, that was per month. And at my last job, I was paying upwards of $400 per month, and my employer, that was half, and my employer was paying the other $400. In total, the health plan, the fully funded plan, was getting $800 per month, and my deductible was, I want to say $3,000 or $4,000. I never met it, so I never actually got to find out what it was. But
so in a sense, you really never had coverage, just a discount.
Yeah, I kind of just had the discount.
So I'm curious, how has that transition been for you coming to the Phia group and now being covered under a self-funded health plan?
I will never take a health plan for granted ever again.
Wow.
I will never work for a company that isn't Phia, I guess, because I just love our health plan. I think that in itself is such an incentive. And the fact that our company offers all these incentives to utilize the health plan, such as if you find a billing error, and I know you know this, but the people out there don't know this. If you find a billing error and you bring it to HR and you say, I never had this procedure, they never gave me this medication when I was in the hospital or whatever, and you say this never happened, and they dispute it and they get that money, and they say this never happened and it gets taken off, you get a portion of that money that you saved the plan from paying.
So you're basically making money by just looking at your bill and identifying things that
you're making
were
money
incorrect.
by caring about your health benefits and the plan and making sure that you're being billed appropriately.
So in your fully insured high deductible past, would you say you had that same caring for health benefits without such incentives?
The only thing I cared about was how much money was coming out of my pocket.
Amen to that.
But with this plan, money doesn't come out of my pocket unless it comes out of my paycheck. And that's just with the standard premium.
So what would you say is your number one favorite thing about our plan here?
I would say 100% hands down, direct primary care, Dr. Tremblay, Action Medicine. I'm going to have to give you a shout out. He is a direct primary care physician. He is about 10 minutes down the street from our office, and I could call him up and I could say something is wrong with me, and he will put in a prescription or tell me what to do, or he'll say, okay, come into the office. I can see you whenever you get here. Very flexible, very open. He has a nurse practitioner that works with him, Brooke Reith, and she is absolutely amazing. I love going in to see her and talking with them. They're both very knowledgeable and skilled people. And the best thing about direct primary care is that it is completely free for me. I do not have to pay 1 cent when I go see them, when they run my lab work, when they write me a referral or whatever. Like, everything is free. And
Right.
it blows my mind that this option is out there for people. I've actually gone to friends and told them about direct primary care, and they've signed up for Dr. Tremblay. So, Dr. Tremblay, if you're listening, I just want you to know that you're welcome.
You're getting free endorsements here.
Yes, definitely. So, Philip, I know that direct primary care was my most favorite part about our health plan. So, and it can be the same for you, but what is your most favorite part about the health plan?
Well, I hate to be repetitive, but direct primary care.
Right.
But for a different reason.
Right.
You know, like I said earlier, I'm not a heavy claims user. I'm not someone who's, visiting 4 or 5 doctors. I usually like to have all my care in one place. So in the past, where I've had to relegate this care to this doctor and this care to that doctor, signing up for the direct primary care was great because it was a one-stop shop. Everything's all under one roof. But I think what I really appreciate about direct primary care is, even though it's no cost to us, it's saving the plan money. So in a sense, I'm going there. I almost feel a little deviant. Like, wait, shouldn't I be paying something, because I'm getting great quality care. But in the end, we're being incentivized because it is saving the plan money. Now, I don't know much about the math on this, but another reason why I would say direct primary care is one of my favorite parts of our plan is because the quality of care I receive. Now, under the fully insured plans where I had to go maybe to a top-notch facility that was covered under the prior plans, a typical physical was, barely any eye contact, any pain here? No. Any pain here? Do you want blood? Well, maybe I don't have that much time right now. Okay, blah, 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 blah. Clean bill of health. And I'd still walk away wondering, how do I know there's not a tumor growing in my stomach? Or how do I know,
Right.
You know what I mean? I've had no labs, no nothing. And they would check it off. So I joined direct primary care and I had my first physical. First of all, it was the most extensive physical I ever had. It was broken up into 2 appointments. One was to obviously collect blood, and then, conducted any other tests. Some tests I've never even had before. A full panel of testing that I've never had at a physical. And as a man my age, I should have been having. And then there was a follow-up appointment where they actually took the time to review the results with me, just to let me know everything was thumbs up, checked off, and I had a clean bill of health. So this was the first time I walked out of that physical without a wonder of wait a minute, I feel like so much was missed. So not only is it no cost to us, it's saving our health plan money, but on top of that, we're getting really great care.
So here's the thing. These doctors take the time to sit with you, to teach you what they know about your body and what's going on or what's wrong with you. And they're just I feel like they just have more time to do so. I feel like all doctors truly care about their patients, but these direct primary care physicians, and I know quite a few in Massachusetts because I work with FMMA and Massahu and just a couple of different organizations. And so I know that they actually truly care about their patients, and they care, they'll text in the middle of the night. I text Brooke one weekend when Brooke Reith from Action Medicine, and I promise this is the last time we're going to be mentioning you guys because you're getting way too much free publicity from us. But I text her.
We're sending a bill, don't worry.
I'll text her on a Friday, and she'll follow up with me if I say I'm not feeling too well, I think I might have the flu or whatever, blah. She'll follow up with me on Saturday, and she'll call, and she'll be like, hey, how are you? How are you feeling? I'm like, oh, well, this is fun because my doctor's never even, I don't think my doctor's seen the inside of a hospital on a Saturday or a Sunday. And she was calling me on Saturday. And I'm like, isn't it your day off? She goes, oh, yeah, but I work every day.
And it's interesting that you mentioned that because before joining direct primary care, do you ever remember being able to access a doctor by text?
Never, ever. I couldn't even get them on the phone, let alone accessing them by text. But I think we've exhausted direct primary care. And there are way more things. Yeah, so many other things that we need to be talking about with our health plan. So let's go back to the diapers and wipes incentive.
Right, the incentives.
Something that you and I don't need
Oh,
right
you
now.
know, you
Right
never
now.
know.
At this
One day.
time. You and I don't need at this time because neither of us has children or a wife that's pregnant. But the thing with our diapers and wipes is that if you or a plan member uses a facility to deliver their children, and it's usually a highly rated facility within I think a 15-mile radius of the office, I want to say, or 15 or 25-mile radius of the office. I know a lot of the hospitals aren't too far out.
Right.
You actually get diapers and wipes free for an entire year.
Wow.
An entire year. Now, I've never personally used this because I
know you want to, though.
am single and mingling. Yeah, I know. I totally would.
Ladies, you all hear that, right?
Yeah, exactly. If 100%, if I could utilize it, I would, because saving all that money, I've seen my cousins spend all this money on diapers and wipes, and it is not for me. That is not what I want to be spending my money on.
Right.
So
right.
What's another incentive that you think, other than direct primary care or diapers and wipes, what do you think is one of our great incentives?
So I would say one of my favorite cost containment incentives we have is in regards to generic drugs. So I am someone, when it comes to my clothes, of course, I prefer name brands. You know what I mean? I'll pay that little extra.
Don't we all?
However, when it comes to my medication, as long as it works, I really don't care.
Right.
And most of my doctors traditionally have always prescribed the generic, they always allow for the generic substitution. However, as I was mentioning, my experience under past insurance plans, it might have been a little cheaper. However, because of that whole high deductible and, certain limits with the carriers, I was still paying a considerable amount out of pocket. Here, under our self-funded health plan, as long as I continue with generics, $0 copay.
$0 copay.
So
for generic drugs.
I started Phia in June. I was eligible for the plan in September. So in September, I was paying $0 copay for drugs. In May, before I started here, I was spending almost $120 a month on drugs.
So here's something. So
prescription drugs.
Got it. So I actually am on a medication that has a high copay because there is no generic. So what I was able to do was go through, I have a friend that works for the pharmaceutical companies, and my friend told me to go on to their website and look for a coupon. And they were able to give me a coupon that covered my entire copay. So even that is now that's a free drug, a free prescription drug, and it's a name brand. I saw the price originally and I was like, oh no, absolutely not. I'm not paying that. And then because I was like, I'm not paying that every month. I have a mortgage to pay. I don't have a family to feed, but I have a mortgage to pay.
The mortgage is the family.
Right, exactly. So that definitely is a big incentive for me because I was able to utilize the coupons, and the health plan was, more than willing to pay for the prescription.
So by saving the health plan money on a non-generic drug, in the end, you still didn't have to pay for it.
Right.
Because you were able to save the health plan money.
Right.
And these are things that can't be done in the fully insured world.
So I think we're coming to a time, Pat's kind of giving me those eyes, where he's like, all right, guys, it's time for you guys to stop talking soon.
All right.
So let's, I will admit how much money I've actually spent out of pocket, if you do.
Out of pocket?
Out of pocket.
Since I've been on the plan?
Since I started on the plan, I will admit how much I've spent.
I'll admit what I've spent too.
All right.
You go first.
All right. I have spent a total of $40.
Wow.
I have spent $40.
Ooh, that sounds expensive for my blood. Because guess how much I have spent? Zero.
I was actually going to say zero.
Which has definitely benefited me in my pocket and has definitely benefited me in my health. Right. Because now I don't have to sit there and count pennies and quarters to figure out whether I can make this doctor appointment or not. And that flexibility and that comfort of knowing that, I have coverage that's going to be there for me and not bleed me dry if, God forbid, I need to use it, it's worth it.
The stress associated with those medical bills that people are getting with fully funded health plans, I feel like is worse than people smoking cigarettes or drinking alcohol or whatever. I think it's worse. The stress is actually worse than what some people are already doing.
Right.
So I think that the healthcare industry is making it difficult for people to stay healthy because once they get healthy, then they get the bill, then they get stressed out, and then they're unhealthy again.
It's a vicious cycle.
It is a vicious cycle.
It's a vicious cycle.
All right. Well, we're about to wrap it up. And
That's
Pat,
great. Thanks for letting us take over.
thank you so much. I
We
appreciate it.
appreciate it.
If you have any questions, please feel free to reach out to us at info@phiagroup.com. And you have myself, Matthew Painten, and Philip Qualo, and Patrick Santos, and we are signing off.
Thank you.
Thanks.